everyone. Today we are going to do the Kickstart series of early pregnancy module, and we are going to present ectopic pregnancy. Here there is a role reversal where I am the candidate and Dr. Priyadarshini Lingaraj is very kindly accepted to be my role player. So we are going to do it exactly as we do in the exams, which means a 2-minute reading time and 10 minutes performance time. However, in the 2-minute reading time, I will just tell you whether when you go into the cubicle, what exactly you're supposed to look at when you see the candidate instructions and how you pick up the main points, because it will not be possible for you to jot down everything. So let me start my timer so that you know that in 2 minutes, how much you can actually follow in a candidate instruction. And it's a very doable thing. So once you enter, you would first have to understand from the instruction whether this is a structured discussion or a simulated patient task. It may or may not say whether it is a simulated patient task, but when it says that you are supposed to discuss with a patient, that is when you know. So you have to understand where exactly you are. So here A and E is where you are, and quickly see the name of the patient and the age. And obviously, as far as information gathering is concerned, there'll be quite a bit in the candidate instruction. So you need to look at that. So here, as you can see, she is amenorrheic in 6 weeks with vaginal spotting and pain. And the ST1 has already done some tests, which is TVS and HCG. And also her observations are mentioned, which means that she is more or less stable except for a bit of tachycardia. And there are important things given here, which means that they are very, very important for this particular station. And if you miss them, then you get marked down on information gathering, main being that she is a Jehovah's Witness. And also that she has a previous history of ectopic for which she has undergone a surgery. Next, there is an image and the report is also mentioned, which says very clearly that the right tube shows an ectopic pregnancy and the cardiac activity is present. That's the other thing that you have to note, because that's what will tell us what the management is. And also that her blood group is AB positive and beta HCG is 2005 international units only. So that takes care of my 2 minutes. And we will start now with the 10-minute timer. Hello, I'm Dr. Priyadarshini, one of the doctors in the A&E today. May I confirm your name and age, please?
Hello, doctor. I'm Samantha and I'm 35.
How may I address you?
Well, Samantha should be fine.
Okay, so Samantha, I can see from what has been told to me that you were in quite a bit of pain and that is why you presented in the A&E. Is that correct?
Yeah,
Are you
yes. It
comfortable
was
to
a bit
talk now?
painful. Yeah, I'm feeling better. Thank you for that.
Have you received some painkillers?
Yes, I did. The nurse
Okay.
did give me, and I'm feeling much better now. Yeah.
Okay, that's good to know. So if you don't mind, Samantha, I would like to ask you a couple of questions before we can move on to the reports and what we can do for you today.
Yes, doctor. But I'm like kind of eagerly waiting to know what's happening with me.
Yes, I can quite understand. So no issues. I could absolutely discuss the reports with you. But just before that, I would like to know, are you all alone in the A&E today or do you have somebody with you?
Yeah, my partner's John is back at work. I've informed him he's on his way to the hospital.
Okay, so would you like someone to be here while we are discussing the report? You know, my nurse could come in and just sit by you because it's quite an important report that I want to discuss with you.
Oh, is there anything that's going to trouble me? Is it worrisome?
Well, it is a bit concerning, I'm afraid, Samantha.
Oh my. Uh, it's okay. I can manage this. You can go ahead.
Okay, so Samantha, as you're well aware that the doctor on call had done your transvaginal scan and had also performed a test which was for your pregnancy hormone. Are you aware of that?
Yeah. The day I saw that I'm pregnant, we as partners were really excited about it. We're really looking forward for this pregnancy.
I can understand that, of course. But I'm afraid that the report is of concern and This report, which I have confirmed is yours, mentions that you have an ectopic pregnancy on the right tube this time.
Really? I mean, why am I going through this again and again? This is the third time, doctor. What is wrong with me? And so that mean, I have to undergo a surgery again. This is really a shocker for me.
I'm so sorry to be the bearer of this kind of news, Samantha, but please give me some time so that I can discuss the different modalities of management with you. I can quite understand coming from where you have been through that this is shocking. But if you want, I can wait for your partner to come in and then we can discuss. Or would you like me to go forward with the discussion?
No, doctor, you can, please go forward because I'm really worried how he's going to react listening to all this. This is really going to be trouble both of us. It's okay. Go ahead, dear.
I know. Please, Samantha, don't worry. I will talk to your partner as well, okay?
Okay.
So,
Okay.
Samantha, I will be telling you in details what we can do for you today. But before that, is it okay if I ask you a couple of questions, just to be able to plan the management better?
Yeah, yeah, doctor, sure. Go ahead.
Okay. So, have you, other than the pregnancy of the last year, the self-ingectomy that you've undergone, have you had any other pregnancies before this?
Yes, doctor. I did have one. The initial one that I had was again an ectopic pregnancy. It was in the
Mm-hmm.
leg tube, but fortunately, they just gave me some injection and I was cured of it.
Okay. So you've had two ectopics, one treated with medicines and the other surgically, right?
Yes, yes, exactly.
Okay. And any other medical problems that you've gone through?
No, nothing that I know of.
Okay. Any family history that I should be aware of?
No, doctor. Everyone is fit and fine in the family.
Okay. And what about your cervical smears? Are they up to date?
Uh, yes, I had my last one 6 months back. But also to mention, my mother is a diabetic.
Okay.
I
Okay.
don't know if that's really going to be of a concern to you.
No, not
My
right
smears
away.
are all fine. My smears are all fine. There's nothing to
Okay.
worry about.
Fine. And what about your partner? Is he supportive?
Yes, he's very, very supportive. He's really been my pillar of support for all these years through.
That's very good to know. And what do you do for a living?
I'm a school teacher.
Okay. And are you allergic to anything?
I'm allergic to penicillins.
Okay,
Yeah, they
I'll
did
I'll
find
make
it
a
out a
note of
year back.
that.
Yes.
Right, I'll make a note of that. And
Okay.
I can see from this that you are a Jehovah's Witness and your blood group is AB positive. Is that correct?
Yes, yes, that's right. I do
And
not
you
take
do have an
accept any
advance
mixed
directive
blood.
in place?
Yes, yes, I do have, and I cannot accept anything else apart from my own blood.
Okay, okay. I'll make a note of that and also inform the sister, the nurse, so that she can put a band on your hand. Okay.
Yes,
So,
all right.
coming to the reports, like I told you, Samantha, that you have an ectopic on the right side of the tube. And the problem with this particular kind of ectopic is that it shows that the pregnancy has a heartbeat. What that
Okay.
means for you is that the only modality of management available to us is surgery because the medicine that you had received last time really will not work on this very well.
So you mean undergoing a surgery? Am I going to lose my other tube also? The only one that I have?
So, Samantha, there are two kinds of surgical process. One is where we only scoop out the pregnancy from the tube after making a cut in the tube. And the other is where we remove the part of the tube which contains the pregnancy. Now, obviously, because you have only one tube, we would need to see the health of that tube and we would decide during the keyhole surgery as to what we can do best for you. However, I would like to tell you that in case we do just remove the pregnancy, then number one, we would have to follow you up regularly with your pregnancy hormones to see that they are coming down, because this particular kind of surgery has a problem that we may not be able to get out the entire pregnancy tissue, and also that you may require a second surgery or even injections after this. Am I clear so far?
Yeah, doctor. I don't mind undergoing any number of surgeries, but I really want the tube back, to be in place My partner and I are really looking forward to start a family, and I do not want any kind of complications, in my relationship.
Of course, I completely understand, Samantha. And coming from where what you've gone through, it's absolutely understandable that you should feel like this. But I assure you that we're going to try and do our best for you, and we're going to try and preserve the tube. But you should know that preserving this tube also puts you at a risk of another ectopic in the future. Am I clear so far?
Okay. Yeah, doctor.
Okay.
Yes.
And also because you are Jehovah's Witness, so we are going to have certain things in place so that, you lose least amount of blood, and also if necessary, then we can transfuse you with your own blood. So of course, the keyhole surgery, as you may well be aware of, has minimal blood loss. So that is one step. And the other is that our consultant laparoscopic surgeon would be doing your surgery himself. And also, we have a special kind of machine which is called a cell saver. Have you heard of it?
No, haven't.
Okay, so this is a machine which basically, takes blood from you when you're losing it and filters it out and then gives you back the purified blood of yours in case you should require a transfusion. So we will have that in place as well.
All right. Okay.
Okay, and in case you do stand to lose your tube, I would like you to know that the only form of fertility option available to you will be test tube baby. Would you like me to clarify on that?
Uh, I just have a doubt. Why am I going through this again and again? Third time, another ectopic. Is there anything wrong that I'm doing to myself?
So I would just like to know one small history, and this is a little
Sure.
bit of a personal question, so please don't mind, bear with me. Have you
All right.
ever, you or your partner, been treated for any sexually transmitted infections?
Well, I do have been treated, almost 4 years back. The doctor did said that I have a very severe infection, and, probably that my tubes and my uterus could have been damaged, but
Yeah,
nothing was
so
confirmed after that.
yes, so that could actually be a reason. Also, do you smoke?
Yeah, I do. It's a lot of stress that's going around. I smoke almost 10 cigarettes per
I
day.
understand. So that itself could also be a risk factor. And if you don't
Mm.
mind, then after all of this is done, I would like you to liaise with the NHS Stop Smoking Services, and they might be able to help you on this.
Sure, sure, I'll get back. I can do anything to save my tubes.
Yes, absolutely. So, Samantha, I know I've given you a lot of information. So, I will also give you some information leaflets which you could just go through while we prepare you for the operation. And I will also get my surgeon to talk to you in case you have any other queries. Is there anything you would like me to explain now?
Yeah, can you just wait till my partner comes here? Is it really so much in hurry that you have to rush up?
No, no, absolutely. We will definitely wait because as of now, your pulse and your, blood pressure that we've checked is fine. And there is no actual bleeding right now. So we can wait at least till your partner comes. In case there is some kind of an emergency, we will then change the plan as then, and we will definitely inform you.
All right. I just
Okay?
want the best to be done to, save my tubes. I'm really
Absolutely.
looking
We
forward.
will definitely try our best. Please be assured about that. And we will try and save your tube. But I just wanted you to know that there is a small chance that you might lose this tube also.
Yes, yes, I do
I'm
understand.
I'm
But
really
thank you
sorry
so
that
much.
you've been going through all this, Samantha, but we are doing our best. Please keep hope.
Sure, doctor. Thank you so
Thank you so
much.
much, Samantha. Anything else that you would like me to clarify?
No, doctor, I'm good.
Thank you so much.
Thank you, doctor.
Okay, so going to the station itself, Priyadarshini, would you like me to give me some feedback?
Well, it was, very well done. Though it was a station of early pregnancy, there was a bit of Breaking Bad also in it, and you beautifully handled it. You started with asking about the pain relief options and whether the patient is comfortable enough to talk about this, and you took her through all the options available. So that is really appreciable, and you didn't rush into that. You took it very slowly, and a very well done station. And there were no jargons that I could really pinpoint to.
Okay, thank you so much, Priyadarshini. So, guys, as you can understand that an early pregnancy station could be a straightforward one or could be, associated with some other things also. For example, a breaking bad news station could well be a lay examiner station. So we would have to keep a note of that as to how we are going forward with it, because we all have at the back of our mind that we have only 10 minutes. So you would have to prioritize the station according to the patient's emotions. You cannot rush through, although you know that you have a 10-minute clock going on. And if she says something like, and we please wait for my partner to come in, and if her findings are suggestive that yes, you could wait, then please, respect that decision. Also, always assure her that the best is being done, and you will have to tell her what are the things that you have in place, so that for her being a Jehovah's Witness and her being a high risk in this kind of a situation, she stands to be least jeopardized. I hope this particular station was of help. And as you go through this, the entire role player and the marking scheme will be present, so you can go through it. And I hope this will help you to perform this station better.